Hello, and welcome to Dermatology Weekly, the official podcast of MDedge Dermatology, where we discuss issues that most affect the specialty. I'm MDedge editor Elizabeth Mishkati.
We're here with Dr. Amber Atwater, Associate Professor of Dermatology at Duke University and the immediate past president of the American Contact Dermatitis Society, and Dr. Raina Bembry, Dermatitis Research Fellow at Duke. And they're here today to discuss some of the highlights of the annual American Contact Dermatitis meeting, the American Contact Dermatitis Society meeting, which was held in March. And welcome to both of you, and thank you for being here. And we're going to start out with the contact allergen of the year, which is a tradition at this meeting where the contact allergen of the year is announced. This year, the ACDS chose an allergen that's been linked to reactions associated with shin pads and sports footwear. And some cases were described in a recent article in the journal Dermatitis.
Yeah, so that's exactly right. Thank you for that introduction. The Allergen of the Year is a really exciting tradition for the American Contact Dermatitis Society. And sometimes they're new and emerging and important allergens, and sometimes they're non-allergens. So things that people talk about a lot in press, but aren't necessarily allergenic from our standpoint. The allergen for 2021 is acetophenone. And this is a chemical that's emerging because of exposures to shin guards or shin pads, as well as sports shoes and flip-flops. So Dr. Raison-Perron and Dr. Sasseville wrote this article for the journal Dermatitis and talked about cases of actually mostly children, teenagers, and young adults with predominantly leg dermatitis that frequently generalized to a more diffuse distribution. And what they found was when they did some complex analyses of the shin guards and shoe parts in question was that the common allergen was acetophenone. So if you all have time, check out that article in Dermatitis. This allergen has not yet been reported in shin guards or shoes in the United States, but certainly has been reported in Canada and Europe. And I suspect that one of the reasons we haven't seen it yet is because the chemical to test for it is not yet commercially available. So those of us in the US should keep a lookout for this allergen as well, especially in this mostly male, actually younger population of individuals who are wearing sports shoes, shin guards, and flip-flops. I'd also like to shout out to the committee that chose this allergen. So Dr. Don Belcito heads up this committee, and we have several really dedicated committee members who help us to figure this out every year. In addition to that, I bet you are all wondering what our new allergen is for 2022, and that is the chemical aluminum. So stay tuned for our article that will come out in early 2022 to learn more about that.
Another one of the studies presented at the meeting was one that found that almost 20% of shoe allergens are not detected with the current screening series. And Dr. Atwater and Dr. Bembry were authors of this paper, and the rest of the authors are all members of the North American Contact Dermatitis Group. And Dr. Bembry, can you tell us more about this study and the results and the implications for doctors and clinicians in this country?
Sure. So this was a retrospective study using NACDG data from 2005 to 2018, looking at patients with a shoe source positive patch test, but as one of 3 sites of involvement in a final primary diagnosis of allergic contact dermatitis. So 352 patients fit the inclusion criteria and were designated as our study group. We compared the demographics of our study group patients to those not in our study group, meaning patients with positive patch test results without a shoe source, but as one of 3 sites of involvement, et cetera. And we found that the patients in our study group were more likely male, less likely over the age of 40, more likely Caucasian, and less likely Asian race. In our study group, potassium dichromate was the most frequent screening series allergen, comprising 29.8% of positive patch test results for screening allergens, followed by p-tert-butylphenol formaldehyde resin at 20.1%, thyramid mix at 13.3%, mixed daclothiazide at 12.6%, carbon mix at 12%, mercaptobenzothiazole and colophony both at 10.4%. But in the most recent cycle for our study, which was from 2017 to 2018, mixed daclothiazide and PTBFR were the most frequent screening allergens. Testing the screening series alone missed 7.6% of concomitant supplemental allergens and 12.2% of reactions to supplemental allergens only. Thus, almost 20% of allergens are missed by not testing supplemental allergens. So, if there is a suspected shoe contact allergy, it's important to get a comprehensive history as it relates to shoes. Ask questions like how many pairs of shoes they own and if they have any idea which shoe is giving them issues. It's also important to rule out more common causes of allergic contact dermatitis. So ask if they're using medicaments like triple antibiotic, topical corticosteroids, or anything else on the feet. In our study, specific details of supplemental allergens were not documented, so we don't know exactly what the supplementals were, but we do know they had a shoe source. And suspected shoe contact allergy used the patient's history to determine which supplementals to test. Supplemental allergens could be any allergen not on the screening series, like other supplemental chemicals or trays, or they could be personal care products and parts of the patient's shoes. It is most important to test the parts of the shoes that are in direct contact with the involved site of the foot. Our study didn't look at specific types of shoes, so it would be hard to associate a specific shoe with contact dermatitis, but potassium dichromate was our most frequent screening series allergen, and it's a chemical used to tan leather. P-butanol formaldehyde resin was our second most common screening allergen, and it's used as an adhesive for leather. So one could presume that leather shoes may be more likely associated with shoe contact allergy. Then looking at the demographics of our study group, who are more likely male and less likely over the age of 40, you can consider contact allergy more likely to shoes of males and to shoes of younger patients.
Another presentation at the meeting that you mentioned was a highlight was was about residual facial dermatitis in patients on dupilumab. Can you elaborate on the results of that study?
Yeah, and one of the reasons I wanted to highlight this study is every year at our annual meeting, we review what we call Fisher resident presentations, which are given by resident students or fellows and based on their research. And so this study won what we call the Gold Award for Best Fisher Resident Presentation. And so this was done by a medical student named Alyssa Ashbaugh, and she was working with her primary mentors were Dr. Nina Bato and Jenny Marase. And so what they did is they were focusing on residual facial dermatitis in patients taking dupilumab. And what they did is a retrospective study of 80 patients taking dupilumab. 61% of their patients had facial dermatitis prior to starting their dupilumab, and 78% improved in about 3 months of taking their dupilumab. However, about 43% of their patients still had facial dermatitis at 3 months. So 35 of their 80 patients still had facial dermatitis at 3 months. And in that group of patients, if they had persistent facial dermatitis, they went ahead and did patch testing to see if they had an allergen contributing to their persistent facial dermatitis. They patch tested 14 total patients of those 35 with persistent facial dermatitis. And of those 14 patients, almost 93% of them had at least one relevant allergen on patch testing. And about 50% of those positive reactions were not on their standard screening series. So they were not on Dr. Bato's or Dr. Marase's standard screening series. And what they found was that the most common supplemental allergens were emulsifiers or surfactants, preservatives, and fragrances. They counseled their patients on their allergens, asked them to avoid them, monitored for follow-up, and 3 of 14 of those patients completely cleared with avoidance of those newly identified allergens, and 7 more were mostly or completely clear with avoidance of those allergens. So 10 of the 14 improved significantly with some extra patch testing and avoidance. So the take-home points here are that for patients with facial dermatitis before starting dupilumab, 28% of those cleared with dupilumab alone. So So the take-home points are that for patients with facial dermatitis before dupilumab, 28% of those cleared with dupilumab alone. And for those who did not clear, there was a significant contribution of allergic contact dermatitis for those patients. And again, And again, 93% of those 14 tested patients had relevant allergens, and about 10 out of 14 had significant improvement when avoiding their allergens. So the big take-home point here is that extended patch testing is needed for patients with persistent facial dermatitis. And then again, that the most common extended positive allergens are emulsifiers or surfactants, followed by fragrances and preservatives. So our second important Fisher Resident Award was for a very important topic in contact dermatitis and dermatology. And this went to another medical student named Vaibhav Garg. He was working with his mentors, Dr. Bruce Brode and Anthony Gaspari in Philadelphia. And what he did with this group was they analyzed patterns of contact allergy in African American and Caucasian patch tested patients in Philadelphia for the years 2009 to 2019, so 10 years. And they reported on a total of 297 patients. 47 patients, or 15.8%, were African American, and 215, or 72.3%, were Caucasian. For this patch tested population, gold for both groups was the most common patch test reaction at 19% for both groups. And I'm just going to say from my perspective, that's not necessarily the most common allergen that we usually see, but that's what they saw in this tested population. And then when they focused in on African American patient patch test results, the most common allergens were nickel at 17%, followed by a preservative, methylchloroisothiazolinone, methyl isothiazolinone at 11%, and then paraphenylene diamine, or PPD, also at 11%. In the Caucasian group, the second most common allergen was also nickel at 13%, followed by fragrance mix 1 at 13%, and balsam of Peru at 13%. When they compared the prevalence of their different allergens for statistical significance, only 2 allergens had a higher frequency in the African American patients as compared to the Caucasian patients. And those were dispersed blue dye and textile dye mix, which is a little bit different than what we've seen in some of the other studies in African American populations, where we commonly see paraphenylene diamine as being statistically more significant than in Caucasian populations. In this study, there was, in fact, a trend for higher PPD in African American patients at 11%, and in the Caucasian patients in 6%, but this was not statistically significant. This group also found that African American males, specifically males, were more likely to have occupational dermatitis as compared to Caucasian males, and that Caucasian males were more likely to have relevant positive patch test reaction to personal care products as compared to African American males. And then the authors point out that ongoing research with larger study populations are needed. And, from my perspective, I agree with this. A small group of 47 African-American patients, we might not be able to make as many generalizations about patch test results as we would like, and really large population studies are needed.
Okay, thank you. That's very interesting. So, and then finally, we have so then another study that was presented looked at social media platforms and allergic contact dermatitis information that is presented on those platforms, and compared them. And can you describe those results?
Yeah, so this was actually a really popular talk at our meeting. So our meeting this year is both live and downloadable, so you can watch it after the fact if you like. And this had some of the highest hit rates of many of the talks at our meeting. So this was a talk given by Morgan Nguyen, who is also a medical student, with her mentors Nina Bato and Jenny Morase. So kudos to Dr. Bato and Morase for their high hit rate this year. But what Morgan and her group did was they looked at 6 different social media platforms. So they looked at YouTube, Instagram, Twitter, Facebook, Google, and Reddit. And what they found was with YouTube, they looked at the top 15 dermatitis videos, and they had anywhere from 24,000 to 320,000 views. And the videos with the top scores were produced by physicians, but those were not necessarily the most frequently viewed. So the scoring was based on quality. When they looked at Instagram and Twitter, they found that the most popular and common hashtags were contact dermatitis, and that was more popular than allergic contact dermatitis and contact derm. So by far, most people were using the hashtags contact dermatitis. And they also commented that Instagram had a higher frequency of posts and more patient authored posts, and they were a little bit more active for patients. Instagram is a little more active for patients. Their overall summary was that patients were the most active on Instagram, Reddit, and Facebook. Reddit did not have a contact dermatitis specific community, and most conversations there were in open forum type conversations, so they were sometimes a little bit harder to find. Facebook has several private groups, some that are specific allergen focused, and the largest one had just about 4,500 people who were involved with it. And then because patients are active here, Instagram, Reddit, and Facebook, these three modes of social media may be areas of opportunity to share educational content with patients.
Dr. Atwater, you're going to discuss the NACDG patch results from 2017 to 2018.
Yeah, so the North American Contact Dermatitis Group is a research group. It includes members from the United States and Canada. And depending on the test cycle, we have anywhere from 12 to 17 members contributing data. So it's a nice way to access pooled data for multiple patients who have been tested over a period of time. And the interesting thing about this group is that all the patients for a given cycle are tested on the same allergens, so it can give us an idea of trends. So the Dr. Joel DeKoven reported on the patch test results for the North American Contact Dermatitis Group for the years 2017 to 2018. And this is the most updated data that's out there. So this is the most recent data. For this cycle, 2017-18, we tested just under 5,000 patients in 14 centers in the United States and Canada. And they were working with a screening series of 70 allergens over that time period. So 70 allergens were consistently tested for all of the patients. As per usual, the number one allergen was nickel. That's been very consistent over many years. And about 16.2% of patients had positive reactions during that test cycle. And of note, this is a little bit decreased compared to some of the previous years. And the highest we had seen it was in 2013-14 when it was at just about 20%. So we've trended down a little bit with that chemical. The number two allergen should not be a surprise to anyone. That was methyl isothiazolinone. And this is a preservative that's found in a lot of different products. And this is the highest frequency that we've seen it at as well, at 15.3%. So compare that to 2015-16 when it was only 13.4%. So that has risen a bit in the last several years. Number three was methylchloroisothiazolinone, which is again a preservative, and it also went up to 11%. Number four is fragrance mix 1, and this one has decreased in the last couple of years. So we had a percentage of 9.2% as compared to 11.3% for 2015-16. And then number 5 is a newcomer to the NACDG screening series and also to being a top 10 allergen, and that is hydroproxide of linalool. So hydroproxide of linalool is oxidized linalool. If you go home and look at the labels on your bottles in your cabinet, you'll start seeing the word linalool a lot. It is a fragrance, and it is a top 5 allergen now with the NACDG screening series at 8.9%. So that's an allergen to keep an eye on. That's an emerging allergen. Two others that I want to just point out. One is parabens. So parabens get a bad name in the lay press. And from a standpoint of allergy, it's a very low allergy risk. So they only came out at 0.6% for the 2017-18 cycle. And the other allergen that I want to highlight is hydroproxide of limonene. So that's oxidized limonene, just like linalool is oxidized. And that had a relatively high frequency at 2.6%. So that's another newcomer and a newer chemical that we were testing during that test cycle. And just like with the shoe study that Dr. Bembry was discussing earlier, testing of supplemental allergens remains really important even for any type of patch testing. And in this case, about 1 in 5 clinically relevant allergens was not on the NACDG screening series. So it's important to keep that in mind if you really want to do comprehensive patch testing for your patient.
That's it for this week's episode of Dermatology Weekly. The peer-to-peer portion of the show is produced by MDedge editor Melissa Sears and editor Alicia Saunders. All of our podcasts are produced by an MDedge editor, Kathy Scarbeck. I'm MDedge editor Elizabeth Mishkati, and this is Dermatology Weekly.